Welcome to our medical assistant practice test. This test consists of 100 questions designed to help you prepare for your medical assistant certification exam. Each question includes an explanation of the correct answer, so you can understand the reasoning behind it. Whether you're just starting out in your medical assistant career or you're looking to refresh your knowledge, this practice test is a great way to get a feel for the types of questions you can expect on the actual exam. Let's get started. 1. E and M codes. A. Define a new patient as being one that is new to the practice or who hasn't been seen by that practice in at least 3 years. B. Are defined as evaluation and medication codes. C. Are selected based on criteria set forth by the American Medical Association. D. None of the above. Correct answer. Define a new patient as being one that is new to the practice or who hasn't been seen by that practice in at least 3 years. New patients are patients that have not been to the practice for at least 3 years, or a patient that has not previously been seen at the practice. Specific E and M codes exist to properly code the primary office visit to reflect the new patient standing. 2. The first place to look for an ICD-10 code should be A. In Volume 3. B. In Volume 2 and then confirm in Volume 1. C. In Volume 4 with confirmation made in Volume 3. D. None of the above. Correct answer. B. In Volume 2 and then confirmed in Volume 1. When coding for diagnosis, codes should first be found in Volume 2, which is the alphabetic index listing. When this code is found, it is then confirmed by finding it in Volume I tabular list. 3. There are 2 coding tables in Volume 2 of the ICD-10 book. What are they? A. Drugs/chemicals and neoplasms. B. Radiology and laboratory codes. C. Cancer and accidents. D. None of the above. Correct answer. A. Drugs/chemicals and neoplasms. Coding tables are added to Volume 2 for disease states that have a number of different variables. Tables of drugs and chemicals and neoplasms can come in a variety of forms, so to assist the coder in locating the correct code for these conditions, tables were added for ease in finding the appropriate code. 4. A clause in an insurance policy that restricts overpayment of benefits due to more than one medical insurance policy is A. Not legal. B. Known as coordination of benefits. C. Used frequently by patients with only one policy. D. None of the above. Correct answer. B. Known as coordination of benefits. Patients who have a primary and secondary insurance plan fall under the coordination of benefits clause. This wording discourages multiple payments for the same procedure. 5. A delivery has just been received in your office. Which of the following scenarios is best when dealing with orders? A. Designate one person to handle all deliveries to avoid confusion. B. Allow anyone in the office to handle deliveries as long as the packing slips and invoices are handled appropriately and at the time the supplies are put away. C. Immediately put all stock away, allowing the person who ordered the materials to handle the packing slips. D. None of the above. Correct answer. B. Allow anyone in the office to handle deliveries as long as the packing slips and invoices are handled appropriately and at the time the supplies are put away. Deliveries received in the office should be put away as soon as possible. The packing sheets should be checked against the materials received to ensure that all items that are to be paid have been delivered. 6. Geographical area is important when A. Establishing fee schedules. B. Handling equipment orders. C. Following office policy on bookkeeping. D. None of the above. Correct answer. A. Establishing fee schedules. Fee schedules are set by the office based on the usual fee charged for a procedure. These usual fees are based on geographic location, which allows fees to remain competitive, yet fair. 7. Aging accounts are addressed. A. typically every 30 days until payment is received. B. Only by the office manager. C. Mainly when patients visit the office. D. None of the above. Correct answer, A. Typically every 30 days until payment is received. Aging accounts are given attention at 30-day intervals. 8. Collection mailings. A. Are more economically feasible when handled using postcards rather than sealed envelopes and, therefore, the most used method of notifying patients by mail. B. Are an attempt to notify a patient of a credit owed the patient. C. Are considered done messages. D. All of the above. Correct answer, C. Are considered done messages. Collection mailings are to remain confidential and should be mailed in an inconspicuous envelope. They are considered done messages as this term implies a notification made to remind a patient of a debt owed the office. 9. A patient has been receiving care from your office while fighting cancer. The patient dies before payment is received in the office. The best way to ensure that the office receives payment for services rendered is: A. Contact the next of kin listed in the patient chart. B. File a claim against the patient's estate. C. Initiate a claim with a collections agency. D. There is no way to receive payment once a patient has expired. Correct answer, B. File a claim against the patient's estate. The only legal recourse for collecting a debt from a patient after he is deceased is to work through the patient's estate. Next of kin is not responsible for a patient's outstanding balance. 10. FICA is: A. Collected by the state to pay for insurance. B. Used to pay for Social Security and Medicare. C. Is voluntary. D. All of the above. Correct answer, B. Used to pay for Social Security and Medicare. FICA stands for Federal Insurance Contribution Act. FICA is collected and used by the federal government to pay for Social Security and Medicare. 11. You witness an automobile accident on the way to work. Which of the following would be an indication that a patient has experienced head trauma? A. Bleeding from the rectum. B. Extreme hunger. C. Vomiting. D. Rapid pulse rate. Correct answer, C. Vomiting. Vomiting is a sign that the patient may have experienced a concussion. Patients that are nauseous after an accident should be evaluated immediately by an emergency professional. 12. Improper placement of the hands under the rib cage when performing the Heimlich maneuver could result in: A. Damage to the manubrium of the sternum. B. Damage to the coccyx. C. A broken xiphoid process. D. None of the above is possible, even with improper hand placement. Correct answer, C. A broken xiphoid process. The xiphoid process is located at the inferior aspect of the sternum. If the hands are placed too close to this process and pressure is applied, the process can break off and damage internal organs. 13. Which type of shock is related to low blood volume? A. Psychogenic. B. Cardiogenic. C. Anaphylactic. D. Hemorrhagic. Correct answer, D. Hemorrhagic. Hemorrhagic or hypovolemic shock are the result of major blood loss. 14. A common fracture found in children that exhibits a bending of the bone with a partial break is A. Compound fracture. B. Comminuted fracture. C. Greenstick fracture. D. Cole's fracture. Correct answer, C. Greenstick fracture. Greenstick fractures are the result of a bone bending and partially breaking, just as a green stick from a tree would exhibit if one was to try to break it in half. 15. A patient reports that she was out in the sun for several hours the day before. She now has a burn that covers her back. The burn does not show signs of blistering, but is warm to the touch and very painful. It appears that the burn affects her epidermis. Which of the following is the most logical diagnosis? A. First-degree burn. B. Second-degree burn. C. Third-degree burn. D. Fourth-degree burn. Correct answer: first-degree burn. First-degree burns usually do not blister and affect only the epidermal layer of the skin. Second-degree burns will affect both the epidermis and dermis, while third-degree burns will also blister. 16. A patient is bleeding profusely from an injury near her wrist. Which of the following first aid procedures would be most appropriate? A. Place a tourniquet on her arm above the injury. B. Place pressure on her brachial artery. C. Place pressure on her radial nerve. D. Cover the bleeding area with wet towels. Correct answer: B. Place pressure on her brachial artery. Applying pressure to the brachial pulse point will slow the bleeding coming from the injury. Tourniquets should not be used as they could potentially inhibit blood flow to the area, which could lead to necrosis of the surrounding tissue. 17. Which of the following safety suggestions would apply to the use of the AED? A. Do not use on the chest area. B. Do not use in water. C. Do not use on females with documented heart conditions. D. None of the above are applicable to the AED. Correct answer: B. Do not use in water. The AED will initiate an electrical charge which is intended to stop the heart. When this charge is launched with a patient that is lying in water, could send the shock out to responders. 18. When teaching a patient to use the three-point gait technique of crutch use. A. The injured leg moves ahead at the same time as both crutches. B. One crutch moves at a time and then followed by the injured leg. C. Both crutches move ahead at the same time followed by both legs at the same time. D. None of the above are correct. Correct answer: the injured leg moves ahead at the same time as both crutches. A three-point gait is used when patients cannot bear total weight on one of the legs. The injured leg will move ahead with both crutches followed by the uninjured leg. 19. What is the actual purpose of a visit or consult of a patient with a physician? A. Chief complaint. B. History of present illness. C. Past history. D. General data. Correct answer: chief complaint. The main reason for the visit of the patient is referred to as the chief complaint. It can also be the primary symptom that a patient states as the reason for seeking medical care. 20. Mrs. Plan, a 46-year-old female, came into your office because of fever and jaundice. She is in her 34th week of pregnancy. The doctor diagnosed her to have hepatitis D infection. Which of the following hepatitis viruses can simultaneously be in her blood together with hepatitis D? A. Hepatitis B. B. Hepatitis A. C. Hepatitis E. D. Hepatitis C. Correct answer: A. Hepatitis B. Hepatitis D infection requires an associated hepatitis B infection. Only people who are already infected with hepatitis B can be infected with hepatitis D. The outcome of disease largely depends on whether the two viruses infect simultaneously or whether the patient is a chronic hepatitis B carrier with a new hepatitis D infection. 21. Which of the following instruments are used for a pelvic examination? A. Light source. B. Speculum. C. Percussion hammer. D. All of the above. E. Both A and B only. Correct answer: both A and B only. Percussion hammer is used to evaluate reflexes of the patient, not for pelvic examination. Light source, speculum and cotton tip swabs are needed for pelvic examination. 22. A medical assistant took the vital signs of a patient. The patient has been complaining of palpitations and dyspnea. His pulse rate is 120 and respiratory rate is 8. What is the patient's condition? A. Bradycardia and bradypnea. B. Tachycardia and bradypnea. C. Bradycardia and tachypnea. D. Tachycardia and tachypnea. Correct answer, B. Tachycardia and bradypnea. The patient has a fast pulse and is breathing slow, tachycardia and bradypnea. The normal pulse rate is 60 to 100 bpm and normal respiration is 12 to 20. 23. Marital status, occupation and lifestyle of the patient are part of the A. Family history. B. Past medical history. C. Social history. D. Chief complaint. Correct answer, C. Social history. The part of the medical history that includes information about occupation, diet, marital status, and sexual activity is the social history. Social history assists the physician in determining whether the patient's lifestyle is a factor for the medical condition of the patient. 24. Infection control and universal precautions guidelines include the following, except A. Wear only PPE when in contact with infected patients. B. Obtain hepatitis B vaccination for occupational exposure to blood. C. Dispose used needles in sharps container. D. Proper hand washing before and after dealing with a patient. Correct answer, wear only PPE when in contact with infected patients. Personal protective equipment should be worn at all times, especially when in contact with infected patients. Universal precaution is an approach to treat all human blood and certain body fluids as if they were known to be infectious for HIV, HBV, and other blood-borne pathogens. 25. The purpose of a spirometer is to evaluate A. Volume of inhaled and exhaled air in the lung. B. Red blood cell mass. C. Blood pressure. D. Hematocrit. Correct answer, volume of inhaled and exhaled air in the lung. Spirometry measures the amount of air inhaled and exhaled from the lungs. It evaluates the movement of oxygen from the atmosphere into the blood circulation. 26. A 45-year-old man came in for edema and fatigue. On physical examination, the lungs had decreased breath sounds, growls, and crackles. The patient has a family history of heart disease and smokes 3 packs of cigarettes and drinks vodka every day. Under what part of the medical history will you include the smoking and drinking habits of the patient? A. Past history. B. Family history. C. Social history. D. Review of systems. Correct answer, C. Social history. Smoking cigarettes and drinking alcoholic beverages are both part of social history. Social history also includes information about occupation, diet, marital status, and sexual activity. 27. Mrs. Williams came to your office with profuse vaginal bleeding because of a spontaneous abortion. Her blood pressure initially was 90/60 mmHg. 5 minutes after, the BP started to go down to 70/50 mmHg. Which of the following positions should you put her in to improve her blood pressure? A. Fowler's. B. Sims. C. Lithotomy. D. Trendelenburg. Correct answer, D. Trendelenburg. The Trendelenburg position involves placing the patient head down and elevating the feet. Trendelenburg position is used by healthcare providers as a first-line intervention in the treatment of acute hypotension and shock. 28. Betsy, a 4-month-old infant, was brought to your clinic because of a seizure. The doctor asked you to obtain a rectal temperature. You obtain it using a digital thermometer and the reading is 104 degrees Fahrenheit. Which of the following is most likely true? A. She has a normal temperature. B. Her seizure is a result of her being febrile. C. The seizure has no connection with the temperature. D. The temperature of the patient cannot result in a seizure. Correct answer, B. Her seizure is a result of her being febrile. Febrile seizure is a seizure caused by a fever in infants or in children. During the seizure, the child often loses consciousness and develops sudden, jerking movements of a limb or of the body, caused by involuntary contraction of muscles. Febrile seizures are usually benign, even though it looks dangerous. 29. Which of the following is not part of the medical history? A. Present history. B. Review of systems. C. Physical examination. D. Family history. Correct answer: C. Physical examination. The physical examination is not part of the medical history. The physical examination is performed after the history. Present history, family history, and review of systems are all components of medical history. 30. The Latin term meaning, "the thing has been decided," is A. Meant by the phrase, residential ipsa liquitur, and says that a claim cannot be retried between two parties. B. Meant by the phrase, residential judicata, and says that a claim cannot be retried between two parties. C. Meant by the phrase, subpoena duces tecum. D. Meant by the phrase, respondeat superior. Correct answer: B. Meant by the phrase, residential judicata, and says that a claim cannot be retried between two parties. A lawsuit that has been decided in the courts cannot be retried. This is described by the Latin term, residential judicata. 31. Of the 4 Ds of negligence, which implies that any damages or injuries that resulted from the physician's breach of duty were directly related to that breach and that no intermittent circumstances or intervening acts couldn't have caused the damage. A. Duty. B. Derelict. C. Damages. D. Direct cause. Correct answer: D. Direct cause. Direct cause is a form of negligence where the physician's actions are directly related to a negative outcome or damage to the patient. 32. Governing the relationship between patients and physicians are A. Rules of conduct called medical ethics. B. Legal laws set forth by the federal government. C. Rules of etiquette taught in health career education programs. D. Codes of conduct set forth by the American Association of Medical Assistants. Correct answer: Rules of conduct called medical ethics. Ethical codes of conduct are oftentimes formulated and written by professional organizations serving patients in the healthcare community. The American Association of Medical Assistants has formed both a medical assistant creed and a code of ethics that medical assistants can reference. 33. In which of the following examples would informed consent be required? A. A patient is apprehensive about an upcoming surgery and chooses not to learn of the risks involved with the procedure. B. A child is rushed to the emergency room after falling from a third-story window. C. An adult in a coma in a mental health institution with no listed next of kin. D. None of the above require informed consent. Correct answer: D. None of the above require informed consent. In emergency situations where delaying treatment could mean the difference between life and death, in situations where the patient refuses to hear the risks, and in situations where patients are mentally incapacitated and no next of kin is designated, informed consent is not required. 34. A woman has died as a result of a motor vehicle accident. She is listed as an organ donor and her family wants to comply with her wishes. Which of the following is true? A. The woman would have had to list herself as an organ donor and notify her family prior to her death that she has considered donating her organs. B. The Uniform Anatomical Gift Act requires the physician caring for the patient to inform the family who receives the donor organs. C. Physicians can choose to go against the deceased's wishes if the family decides that organ donation is not an acceptable choice. D. Physicians have the legal responsibility to inform patients of the risks involved in donating organs. Correct answer: C. Physicians can choose to go against the deceased's wishes if the family decides that organ donation is not an acceptable choice. Families that are left behind after the death of a loved one may not agree with organ donation. Physicians may choose to go with the wishes of the family over the wishes of the deceased if the family will suffer emotional trauma from the donation. 35. According to the Labor Standards Act, employee health records are required to be retained for A. 10 years. B. 3 years. C. Varies by state, but usually 10 years after last date of employment. D. Permanently. Correct answer, B. 3 years. The Labor Standards Act requires employee health records be retained by the healthcare facility for a period of 3 years. 36. What body regulates the laws concerning workplace discrimination? A. Chicago. B. United States Employment and Equal Opportunity Commission. C. United States Equal Employment Opportunity Commission. D. American Disability Association. Correct answer, C. United States Equal Employment Opportunity Commission. The United States Equal Employment Opportunity Commission, otherwise known as the EEOC, regulates the laws concerning workplace discrimination. If an employee wishes to file a discrimination claim, they would contact this commission. 37. A specific statement that is written by an agency that depicts the minimum level of care is A. Goal. B. Objective. C. Regulation. D. Standard. Correct answer, D. Standard. A standard is a specific regulation or statement that is written by an agency depicting the minimum level of expected care. Standards are written sequentially and can be organized by a series of numbers and letters. 38. A formal contract between two or more healthcare team members to provide services to a patient is A. Referral. B. Recommendation for care. C. Contract for care. D. Physician's agreement. Correct answer, F. Referral. A referral is a formal contract between two or more healthcare team members. This is for the purpose of providing services to the patient and is often used when a primary care physician refers his/her patient to other physicians or healthcare specialties for a specialized type of care. Some examples would be a dietitian, an occupational therapist, a speech therapist, etc. A PCP could send a patient also to a cardiologist, gastroenterologist, or an endocrinologist or any other specialty office. 39. A voluntary credential process usually made by a non-government agency is A. Registration. B. Certification. C. Licensure. D. Bonding. Correct answer, B. Certification. Certification is a voluntary process and under most circumstances it is usually made by a non-government agency. The purpose of certification is to ensure that the standards met are those necessary for safe and ethical practice of the profession. 40. The memory of a computer is located A. In the CPU. B. In RAM. C. In ROM. D. All of the above. Correct answer, D. All of the above. Depending on the type of memory, RAM, ROM and the CPU can all be areas where data can be stored. 41. 1 MHz equals A. 1 million cycles per second. B. 1 million cycles per minute. C. 1,000 cycles per second. D. 100,000 cycles per minute. Correct answer, 1 million cycles per second. The prefix, mega- means 1 million. A megahertz is 1 million cycles per second. 42. Which of the following programs would be best suited for making a patient database? A. Microsoft Word. B. Microsoft Excel. C. Microsoft Access. D. Microsoft PowerPoint. Correct answer, C. Microsoft Access. Microsoft Access is a commonly used software program for developing databases. While Excel is useful for spreadsheet applications, Access allows for more cross-referencing of information. 43. Portable Universal Serial Bus Drives are also known as A. Floppy drives, B. CD drives, C. Flash drives, D. None of the above. Correct answer, C. Flash drives. USB drives are also known as flash drives and are portable memory storage units. 44. The atlas and the axis. A. Are found in the vertebrae. B. Can be described as being cervical. C. Are the first two bones that form the column for the spine on the superior aspect. D. All of the above. Correct answer, D. All of the above. The atlas and the axis are the first two cervical vertebrae and are designated C1 and C2. The atlas, C1, forms support for the skull, and the axis, C2, allows for rotation of the skull. 45. The body system that functions to maintain fluid balance, support immunity, and contains the spleen is the A. Lymphatic system, B. Digestive system, C. Urinary system, D. Reproductive system. Correct answer, Lymphatic system. The lymphatic system functions both for protection from foreign invaders and for fluid balance. In addition to the spleen, the lymphatic system also includes the tonsils, thymus, lymph nodes, and lymph vessels. 46. The duodenum. A. Is the third section of the small intestine, which leads immediately to the colon. B. Is the section of the stomach where the gallbladder delivers bile. C. Is the section of the small intestine where the pancreas delivers insulin. D. None of the above. Correct answer, D. None of the above. The duodenum is the first part of the small intestine where the majority of digestion takes place in the gut. The gallbladder and pancreas will deliver its digestive juices to this section of the small intestine. The pancreas will deliver amylase and lipase while the gallbladder will deliver bile. 47. This particular gland of the endocrine system secretes a hormone that is known to assist with the sleep/wake cycle. What gland is it? A. Pituitary, B. Pineal, C. Pancreas, D. Hypothalamus. Correct answer, B. Pineal. The pineal gland, located in the brain, secretes melatonin. This hormone is known to regulate the sleep/wake cycle in response to exposure to light. 48. A doctor writes out a prescription for medication to be taken as needed for pain. Which of the following abbreviations could the medical assistant expect to see on the prescription form? A. CHF, B. ATB, C. AC, D. PRN. Correct answer, D. PRN. The abbreviation PRN is used to indicate as needed. It is commonly found on prescription sheets that are used to fill a medication order for pain medications. 49. A patient has been diagnosed with a mycotic condition. Which of the following drug types would be used to treat this condition? A. Antifungal, B. Antiarrhythmic, C. Diuretic, D. Antiemetic. Correct answer, A. Antifungal. Mycotic infections are caused by fungi. To appropriately treat this condition, an antifungal medication would be needed. 50. A physician's order instructs a medical assistant to take a temperature at the axilla. Where would the Massachusetts place the thermometer? A. In the rectum, B. In the mouth, C. On the temples, D. In the armpit. Correct answer, D. In the armpit. The axilla is the area of the armpit located under the arms, proximal to the trunk. 51. The word part found at the beginning of a medical term is most likely A. Prefix, B. Suffix, C. Combining vowel. D. Combining consonant. Correct answer, A. Prefix. Prefixes are word parts that precede medical roots. Prefixes give terms a more exact meaning and help to better define a term. Suffixes are found at the end of terms, while combining vowels are used to join word parts. A combining consonant is a nonsense term that is not used in medical terminology. 52. The lateral malleolus is comprised of which of the following bones? A. Fibula. B. Tibia. C. Malleolus. D. Ilium. Correct answer, C. Malleolus. The lateral malleolus is located on the lower extremity at the distal end of the fibula, also known as the external malleolus. The shape is of a pyramidal form and somewhat flattened from side to side and is the attachment site for the calcaneofibular ligament. The lateral malleolus descends to a lower level than the medial malleolus, and the lateral malleolus is often the site of ankle injuries and fractures. 53. The most common vowel used to combine word parts in medical terms is in A, B, E, C, I, D, O. Correct answer, D, O. The letter O is the most commonly used vowel to join word parts in medical terms. The vowel I is the second most commonly used vowel. 54. Which of the following is most true about the ESR test? A. The results are diagnostic for certain conditions. B. Abnormal results are indicative of a potentially fatal illness. C. Abnormal results should be followed with additional testing. D. Results are reported in millimeters per minute. Correct answer, C. Abnormal results should be followed with additional testing. The erythrocyte sedimentation rate is a screening test for inflammation. The test is not used to diagnose any condition, and abnormal results should be investigated further. Results are reported in millimeters per hour. 55. A patient who is blood type AB. A. Can receive plasma from a type B donor. B. Can receive whole blood from a type A donor. C. Can receive packed RBCs from a type O donor. D. All of the above. Correct answer, C. Can receive packed RBCs from a type O donor. A patient who has blood type AB has AB antigens on his red blood cells. A donor that has antibodies to AB antigens cannot donate plasma to an AB patient. Of the above listed answers, only an O-type donor can donate to this patient, as O donors have no antibody-stimulating antigens and no donated antibodies since the donation was packed with red blood cells. 56. Which of the following is considered an abnormal lab result? A. WBC 10,000/mm cubed. B. HCT 50%. C. ESR 22 mm per hour. D. All of the above are normal. Correct answer, C. ESR 22 mm per hour. Normal values for ESR are 0 to 10 mm/HR for men and 0 to 20 mm/HR for women. 57. The mordant in the Gram stain procedure is A. The crystal violet. B. The methyl alcohol. C. Iodine. D. Safranine. Correct answer, C. Iodine. The Gram stain procedure uses 4 chemicals: crystal violet, primary stain, Gram's iodine, mordant, methyl alcohol, decolorizer, and safranine, counterstain. 58. To properly read a meniscus. A. Hold the measuring device at eye level and read the bottom of the curve of the liquid level. B. Hold the measuring device at eye level and read the top of the curve of the liquid level where the liquid holds to the walls of the container. C. Hold the measuring device at table level and looking down into the measuring device, read the bottom of the curve of the liquid level. D. Hold the measuring device at table level and looking down into the measuring device, read the top of the curve of the liquid level. Correct answer, A. Hold the measuring device at eye level and read the bottom of the curve of the liquid level. To accurately measure liquids that are in containers, hold the container at eye level and read the volume at the bottom of the meniscus. 59. The purpose of performing quality control is to A. Create a paper trail to show that the laboratory is compliant with OSHA standards for quality control. B. Improve the odds that the results that are reported for any given test are as accurate and reliable as possible. C. Are required by law to be part of a quality assurance program. D. All of the above. Correct answer, B. Improve the odds that the results that are reported for any given test are as accurate and reliable as possible. Quality controls are done for each analyte tested to ensure reliability of the results obtained from that test. There are no laws requiring that QC be performed, but most accrediting bodies will require QC to be done in order to maintain accreditation. 60. A urine pregnancy test. A. May be negative even if a blood pregnancy test is positive. B. Is positive only during the first trimester of pregnancy. C. Will be negative if the amount of LH isn't enough to meet or exceed the sensitivity of the testing device. D. All of the above. Correct answer, may be negative even if a blood pregnancy test is positive. Urine pregnancy tests detect HCG in a pregnant woman's urine. Blood levels of HCG are usually higher and register earlier than HCG levels in the urine. 61. When reading urines microscopically, urine casts must be A. Small enough to be seen under high power. B. Assessed under low power. C. Absent as to not impede the observation of other microscopic structures. D. None of the above. Correct answer, B. Assessed under low power. Casts in the urine are much larger than most of the other microscopic structures. Casts should be observed under low power so their presence can be noted. Using high power could cause the viewer to over-magnify and miss the structures. 62. All of the following are devices that save information for future reference, except A. CD-ROM. B. Hard drive. C. CPU. D. Flash drive. Correct answer, C. CPU. CD-ROM, hard drives and flash drives are devices that save information for future reference. CPU, Central Processing Unit, supervises data processing operations of a computer, and is not a device for storage of information. 63. Which keyboard key keeps the alphabet letters in uppercase? A. Caps. B. Home. C. Tab. D. Control. Correct answer, Caps. Caps Lock is a keyboard key that enables or disables all the letters from being typed in uppercase. The Caps Lock key is a modified shift key that occupies the same position on the keyboards of typewriters. 64. A first-class mail handling for items 70 pounds or less that takes 2 to 3 days to arrive. A. Priority mail. B. Express mail. C. Certified mail. D. Registered mail. Correct answer, A. Priority mail. Priority mail is a first-class mail with weight more than 11 ounces. It is used when 2 to 3 day delivery is preferred. The maximum weight is 70 pounds, and maximum width is 108 inches. 65. Programs that direct a computer to perform specific operations. A. CPU. B. Motherboard. C. Random access memory, RAM. D. Software. Correct answer, D. Software. Computer software is any set of machine-readable instructions that directs a computer's processor to perform specific operations. Computer software differs with the hardware, which is the physical component of a computer. 66. A letter style in which all lines begin at the left margin. A. Modified block. B. Semi-block. C. Full block. D. Simplified. Correct answer, C. Full block. Full block is a letter style in which all lines begin at the left margin. It is the most common style. 67. When delivery of mail is guaranteed the following next day, the mail classification is A. Priority mail. B. Registered mail. C. Express mail. D. Certified mail. Correct answer, C. Express mail. Express mail is a premium service which is requested when a next-day delivery is warranted. It can be used for letters, documents, or other shipments. 68. Where two or more computers are linked in order to exchange files, allow electronic communications and share resources, such as printers and CDs. A. Network. B. Processor. C. Scanner. D. Internet. Correct answer, A. Network. A network consists of two or more computers linked together in order to share devices, such as printers, hard drives, and allow electronic transfer of data. The computers can be linked through cables, Wi-Fi, or infrared beams. 69. What is the most widely used regular envelope size? A. Number 9. B. Number 10. C. Number 11. D. Number 12. Correct answer, B. Number 10. The most commonly used envelope size is the number 10. Regular envelope is a closed-face envelope with no window. They are the most common used in business to send letters and other mailings. 70. Which of the following is not an incoming mail procedure? A. Stamp items with person who received it. B. Distribute mail to appropriate staff. C. Check clinical mail for urgency. D. Stamp payment checks with endorsement. Correct answer, stamp items with person who received it. Mail should be stamped with the date received, not the person who received it. Other incoming mail procedures: distributing mail to appropriate staff, stamping payment checks with endorsement, and checking mail for urgency, and sorting according to type. 71. To treat a cold. A. See a doctor for an antibiotic prescription. B. Use palliative treatment options. C. Take in many more calories than usual, as in, feed a cold, starve of fever. D. All of the above. Correct answer, B. Use palliative treatment options. Colds are caused by viruses that cannot be effectively treated with antibiotics. Treating a cold consists of palliative options to relieve the suffering from the symptoms until the body can fight off the infection. The phrase, feed a cold, starve of fever, is antiquated. Those that are sick should follow the advice of their physicians and take in as many calories as necessary to promote the regaining of health. 72. The procedure used to remove the gallbladder is called A. Cholecystectomy. B. Cholelithiasis. C. Colectomy. D. Cystoscopy. Correct answer, A. Cholecystectomy. Removal of the gallbladder is necessary when it can no longer function appropriately due to blockage from stones or infection. The proper term for this procedure is cholecystectomy. 73. Although not present with all migraines, which of the following is a symptom of migraine? A. Increased sensitivity to light, sound, and/or smell. B. Aura. C. Nausea with or without vomiting. D. All of the above. Correct answer, D. All of the above. Patients with migraine headaches may report a number of varied symptoms which can include aura, visual disturbance, increased sensitivity to light, sound, or smell, and stomach upset. 74. Testing for preeclampsia is done. A. On toddlers who have seizures. B. On the elderly with syncope. C. On preteens with epistaxis. D. On pregnant women. Correct answer, D. On pregnant women. Preeclampsia is a condition that can lead to stroke in pregnant women with high blood pressure. Proteinuria is an easily detectable sign of impending preeclampsia and can be easily tested with a urine dipstick. 75. Patients with pancytopenia. A. Have an increased risk of hemorrhage. B. Have an increased risk of developing infection. C. May be anemic. D. All of the above. Correct answer, D. All of the above. Pancytopenia is defined as having a low count of all three of the cellular components of whole blood. This could lead to increased chance of infection from low white blood cells, anemia from low red blood cells, and increased bleeding risk from low platelet counts. 76. A patient presents to the office with a chief complaint of RLQ pain. Which of the following pathologies would be most likely possible? A. Appendicitis. B. Gallstones. C. Splenomegaly. D. Pancreatitis. Correct answer, A. Appendicitis. The appendix is located on the inferior aspect of the cecum in the colon. This organ is located in the right lower quadrant of the abdomen. 77. This is the part of the prescription form that indicates the names and quantities of ingredients to be included in the medication. A. Inscription. B. Superscription. C. Subscription. D. Rx. Correct answer, A. Inscription. Several different pieces of information are necessary on a prescription pad. The inscription is the portion of the form that indicates the ingredients to be used in the medication. 78. To ensure that verbal orders for medications are recorded accurately. A. The medical assistant should read the order back to the physician. B. The medical assistant should ask for clarification on any misunderstood information. C. The medical assistant should write down the order exactly as written. D. All of the above. Correct answer, D. All of the above. Taking verbal orders introduces the potential for errors. Medical assistants can reduce the chance for errors by writing the orders down exactly as heard, repeating the order back to the physician, and asking for clarification. 79. If a medication order states that 300 mg of medication are to be given QID for 10 days, how many total milligrams of medication will be given over those 10 days? A. 3,000 mg. B. 9,000 mg. C. 12,000 mg. D. None of the above. Correct answer, C. 12,000 mg. The abbreviation QID means 4 times per day. 300 mg 4 times per day times 10 days is equal to 12,000 mg. 80. A doctor orders 500 mg of medication. Available in stock are 1 gram tablets. How many tablets should be given to the patient? A. 1. B. 2. C. 1/2. D. 3/4. Correct answer, C. 1/2. The first step is to convert milligrams to grams. It takes 1,000 milligrams to make 1 gram, so divide 500 by 1,000. The result is 0.500 grams. 0.5 grams is 1/2 of 1 gram. Therefore 1/2 of a tablet should be given. 81. To most accurately measure medication. A. Use a syringe that is closest in volume to the amount of medication needed. B. Read oral medication volume that is poured into a small measuring cup at eye level. C. Double-check the order for accuracy. D. All of the above. Correct answer, D. All of the above. Measuring medication is a responsibility of a medical assistant that requires attention to detail. Accurate syringe measurements are most effective when the volume of medication closely matches the total volume of the syringe without going over. Reading measuring cups at eye level ensures that the measurement is taken straight on, which reduces the chance for reading errors. 82. The form of a drug when a drug is sweetened and flavored but is thinner than syrup. A. Elixir. B. Liniment. C. Spirits. D. Tincture. Correct answer, A. Elixir. An elixir is a drug that is sweetened and flavored, however, it is thinner than syrup. The active ingredients of elixir are mixed with a liquid, usually a kind of syrup or alcohol, in which they can dissolve. 83. The study of harmful substances or poisons is classified as A. Pharmacodynamics. B. Pharmacopoisonology. C. Toxicology. D. Pharmacotherapeutics. Correct answer, C. Toxicology. Toxicology is a branch of pharmacology concerned with the study of the adverse effects of chemicals on living organisms. It is the study of symptoms, mechanisms, treatments, and detection of poisoning. 84. When a drug is used externally with massage to produce the feeling of heat to the area, the form of drug is A. Liniment. C. Elixir. B. Lotion. D. Solution. Correct answer, A. Liniment. Liniment is a form of a drug that is used externally with friction to produce the feeling of heat to an area. It is a liquid that is rubbed on the skin to relieve pain or stiffness in the muscles. 85. The classification of drugs that prevent or stop the patient from further bleeding are A. Anticoagulants. B. Diuretics. C. Hemostatics. D. Antiarrhythmics. Correct answer, C. Hemostatics. Hemostatics are drugs that prevent or stop the patient from further bleeding. Hemostasis is achieved through three mechanisms that work together to stop the flow of blood: vasoconstriction, platelet plug formation, and clotting of blood. 86. Which of the following is not included in the 6 rights of drug administration? A. Right dose. B. Right time. C. Right route. D. Right doctor. Correct answer, D. Right doctor. The 6 rights of drug administration are right medication, right route, right time, right patient, right dosage, right documentation. Right doctor is not one of the 6 rights of drug administration. 87. A patient displays the following body language: slumped shoulders, grimace, and stiff joints. What message is this patient sending? A. Anger. B. Aloofness. C. Empathy. D. Depression. Correct answer, A. Anger. Body language is a form of nonverbal communication. Negative messages can be sent easily with the use of improper or tense posture. Anger is conveyed by grimacing as if in pain and tensing the shoulders. 88. To assure that a medical assistant has understood what a patient has stated, which of the following scenarios would best verify understanding? A. Repeat what the patient said word for word. B. Repeat parts of what the patient has stated. C. Summarize what the patient stated, asking questions where you are unclear. D. Ask the patient to repeat what he said. Correct answer, C. Summarize what the patient stated, asking questions where you are unclear. Summarizing what a patient has told you allows you to use your own words to verify understanding. Repeating what has been said can only verify that you were able to hear what was said. 89. A patient has been coming to your office for many years. You know the patient and her family very well as they are all cared for by your office. The patient has invited you to her son's wedding. Which of the following would be the best response to this invitation? A. Decline the invitation but convey your best wishes. B. Decline the invitation stating that it is against office policy to socialize with patients. C. Accept the invitation but do not let anyone else in the office know that you are attending. D. Accept the invitation if others in your office were also invited. Correct answer: decline the invitation but convey your best wishes. To maintain the highest level of professionalism in the workplace, it is best to avoid personal relationships with patients. While it may be tempting to befriend a patient who shares interests and personality traits, it's not in the best interest of office professionalism to do so. 90. Which of the following is the highest in Maslow's hierarchy of needs? Self-esteem. B. Safety. C. Social. D. Self-actualization. Correct answer: D. Self-actualization. Self-actualization is the highest of Maslow's hierarchy of needs. It is the achievement of one's full potential. 91. Which of the following is not considered nonverbal communication? A. Facial expressions. B. Interjection. C. Hand gestures. D. Posture. Correct answer: B. Interjection. Interjection is a form of verbal communication. It is a word or phrase expressed in a strong emotion. Nonverbal communication includes grooming, dressing, eye contact, facial expressions, hand gesture, space, tone, and posture. 92. The 5 stages of grief, according to Elizabeth Kubler-Ross, come in the following order. A. Denial, anger, bargaining, depression, acceptance. B. Anger, bargaining, denial, acceptance, depression. C. Bargaining, denial, acceptance, depression, anger. D. Acceptance, denial, anger, bargaining, depression. Correct answer: denial, anger, bargaining, depression, acceptance. The proper order of the 5 stages of grief by Elizabeth Kubler-Ross is denial, anger, bargaining, depression, and acceptance. 93. In the U.S., the personal space used in public is A. 1 to 4 feet. B. 4 to 12 feet. C. 12 to 15 feet. D. Up to 2 feet. Correct answer: C. 12 to 15 feet. In the U.S., personal space in public is 12 to 15 feet. Intimate is touching to 1.5 feet. Social is 4 to 12 feet. 94. What is a phobia? A. Irrational fear of objects or situations. B. Reaction to actual danger. C. Obsessions. D. Compulsion to do something. Correct answer: irrational fear of objects or situations. Phobias are irrational fears of objects or situations. It is an abnormally fearful response to a danger that is imagined or is irrationally exaggerated. 95. Patients who are habitually late. A. Should be charged a late fee. B. Should be scheduled at the end of the day. C. Should be rescheduled for another day each time they are late. D. Are showing signs of mental incapacity. Correct answer: B. Should be scheduled at the end of the day. Patients who are habitually late should be scheduled for the end of the day so other patients who have arrived on time do not have to wait for their appointment times. 96. Patient cancellations should be noted. A. On the daily schedule. B. In the patient's chart. C. In the progress notes section. D. All of the above. Correct answer: D. All of the above. Patients who cancel appointments should have this information placed on the schedule to open the time slot up to other patients and in the patient's chart in the progress notes section. 97. The medical assistant that handles the scheduling has scheduled 3 patients for the 3 to 4 o'clock time frame. All of the patients were told to arrive at 3 o'clock. Which of the following scheduling methods best describes which is being used in this example? A. Double booking. B. Wave. C. Walk-in. D. Advance. Correct answer, B. Wave. Wave scheduling requires having patients scheduled for the top of each hour. Patients are then seen in the order that they arrive in the office. This will allow for small shifts in appointment times if patients arrive early or late. 98. What type of scheduling is used when 2 or more patients are scheduled at the same time? A. Wave scheduling. B. Time-specific scheduling. C. Double booking scheduling. D. Modified wave scheduling. Correct answer, C. Double booking scheduling. Double booking scheduling is when 2 or more patients are scheduled at the same time. It is used by practices with short visits or high no-show rates. 99. Maintenance of office cleanliness and arrangement is the responsibility of A. The maintenance company paid to clean the office. B. The landlord who rents the office space. C. All staff of the physician. D. The medical assistant. Correct answer, C. All staff of the physician. Cleanliness and order in the office is maintained by all the staff of the physician, not only the medical assistant. There may be a company contracted to clean the office at the end of the day, however, maintaining it is the staff's responsibility. 100. If you were tasked to record the minutes of a meeting, which of the following would not be included in the information you record? A. Names of the attendees. B. Names of the absentees. C. Agenda. D. None of the above. Correct answer, D. None of the above. In recording meeting minutes, the following information should be included: names of attendees and absentees, time, date, and location of the meeting, agenda and motions. All of the choices are needed, thus there is no exception. Congratulations! You have completed the test. Don't forget to like this video and subscribe to our channel for more resources.